And now I'm very pleased to invite Professor Eugenijus Laurinaitis to give his presentation to us. He is the retired professor from the Department of Psychiatry at Vilnius University. He's the General Secretary of the European Association for Psychotherapy, and he has worked with the European Association for 30 years. And I'm pleased to ask you now, Eugenijus, to give us your presentation.
Good morning, my dear colleagues. And I want to send, first of all, a huge congratulations for your nation for standing the whole year against a huge, terrible aggression which happened to your country. And I'm sure you will win. You will win together with all people of goodwill who are supporting you, who are feeling for you, and who are working for your victory. But now I want to start to talk about the topic I have chosen, the ethics of winners and the ethics of losers. And first of all, I want to stress that it will be not about the war in the first point, but about our inner workings, about our psyche. So it seems that the philosophy of war is basically foreign to the practice of therapy. However, military metaphors were used in the psychotherapy vocabulary since the very beginning. Just look at Freud's writings. The process of regression was equaled to the retreat of the army in the face of defeat by overwhelming army of the enemy. The very name of the most popular mental mechanisms, defense mechanisms, suggest some inner war in our psyche. Many of our patients also use the metaphor of victory over themselves as a way to improve their lives, but they not realize who will be the loser in this fight. Although it seems appropriate, it has both conscious and unconscious impact on our everyday work and feelings. Who is a winner and who is a loser in the psychotherapy process? It is important to mention that ethics is first and utmost not the theory of choice, but the principles of actions for us practitioners. This can be very different in different settings and situations. If we agree that psychotherapy is a helping, what for me means also caring profession, we should look what in this act are the most important components. Here we find two contrasting approaches. While consequentialists and deontological ethical theories emphasize generalizable standards and impartiality, ethics of care emphasize the importance of response to the individual. The distinction between the general and the individual is reflected in their different moral questions. For theories of deontological ethics, this is the question, what is just? When we talk about emphasis on individual response, the question is completely different, how to respond. Very famous ethicist, the philosopher Carol Gilligan from United States, considered the originator of the ethics of care, emphasized the importance of response to the individual. And she says that generalized standards are morally problematic, since it can breed moral blindness and indifference. The former sometimes are called masculine, the latter feminine, but this is not about gender. First group of ethics is concentrated and founded on justice and abstract, but important duties and obligations, while the second tend to emphasize empathy and compassion over the notions of morality. As a consequence, the first group of values actually gives the ground to fight inside ourselves, between ourselves, among ourselves, what is right or wrong, while the other one asks for deep and empathic cooperation in the mutual search for answers. So what are the basic assumptions for this theory of the ethic of care? First of all, persons are understood to have varying degrees of dependence and interdependence to one another and on one another. Second principle is that other individuals affected by the consequences of our choices deserve consideration in proportion to their vulnerability. And this is crucially important for us to remember the vulnerability of our patients and clients. And third basic assumption is that situational details determine how to safeguard and promote of interest of those involved in this exchange and mutual process of psychotherapy. We know very well that from the first theories of the deficit as a cause of pathology were proposed, just to start by Anna Freud, Michael Balin, Franz Alexander, Heinz Kohut, and many, many more. The empathy, mutual efforts, corrective relational experience, and cooperation are growing in importance in our understanding what the process is and what the essence is of psychotherapy. So now we consider the process of psychotherapy like intimate relationship with a professional, and this is more feminine approach. However, in this intimate relationship grows the risk of crossing the boundaries, and boundaries are extremely important, both mental and physical, to keep the psychotherapy as a helping process. So here, the masculine values are coming to the fore, reminding us of the ambivalence of our world. We must agree that it's very difficult to find one best set of ethical rules for our profession. One of the theorists of ethic of care, John Tronto, argues that indeed we have to keep some moral philosophy in our minds when we are engaging in the relationship with anybody, and especially with our patients. And we must always remember of the concept of human goodness. And this must be kept in line with what Tronto names naturalness. This refers to the socially and culturally constructed roles of our society we are living in. And John Tronto, thinks that in our society, the women role is more about caring, and therefore it's a little bit dubious if it can be put universally on all practitioners of psychotherapy. But she set some 5 rules of the principles of care to keep this important attitude. First of all, attentiveness. It's crucial to ethics of care because care requires recognition of others' needs in order to respond to them. And here we have an inner conflict between ignorance and attentiveness. Therefore, we must keep our attention vigil all the time. Next principle is responsibility. We take this responsibility of care upon ourselves. So therefore, we need to keep some universal pre-established rules of our society, who is responsible for what. And here is also interesting that Tronto sees difference between responsibility and obligation. And responsibility is ambiguous. And for example, in my own practice of psychotherapy, I feel that responsibility on actions is upon me, but responsibility on decisions is on the patient side. Next principle is competence. And this is, I think, quite obvious and self-understanding. If we are not competent to care, we cannot help. But next thing is responsiveness. And Tronto states that responsiveness signals an important moral problem within care. By its nature, care is concerned with conditions of vulnerability and inequality. She further argues that responsiveness doesn't equal reciprocity. Rather, it is another method to understand vulnerability and inequality. And finally, but not less importantly, is a principle of plurality, communication, trust and respect, and finally, solidarity in caring. These are the qualities necessary for people to come together in order to take collective responsibility, to understand their citizenship as always put in relation to care, and to take seriously the nature of caring needs in society. And this connects us absolutely to the contemporary historical situation, and not only in Ukraine, but in all Europe and probably in all the world, because we are seeing collectively the history repeating itself in the worst examples. Just remember Anschluss of Austria and occupation of Czechoslovakia by Hitler. One important thing is that when we are working and sometimes openly discussing these 5 principles with our patients and clients, we see sometimes implementation of these principles as a victory and the losing these principles in our work as a defeat. And this is not the case because this dichotomous approach is actually the loss for both of us, for the patient and for the therapist. And one thing which is about group or societal principles for our ethics is understanding that no matter how ethical we shall try to be, the events of the outer world are drastically intervening in our calm offices. This is not only the terrible unprovoked war in Ukraine, but also all tragic natural disasters. Just remember earthquake in Turkey and Syria now. This is continuous shootings in American schools. We all read about that. And this is all about loss, fear, anxiety, but also aggression and grief. These feelings are extremely strong. So it influences our inner worlds as intensely as anybody else. How and if we can protect our integrity as therapists and our patients in their vulnerability, this is an essential question for our professional ethics. I can't propose a best answer, but only put the question to all participants of our symposium about possible ways of practicing our impossible profession in our impossible times. Probably, majority can agree with the conclusion of the presentation. There are no winners and losers, but the therapy and its ethics in this continuous multifaceted war if this military approach is applied to psychotherapy. And therefore I think that we may solve, at least in my own understanding, this dichotomous division of our inner psychic world if we accept that while losing our fight for anything with the patient, we are winning his or her strength to decide and to solve their problems by themselves. And here I want to cite Nelson Mandela. He told, in every situation, you should put others in front and keep yourself at the back of the procession. And then you make this being in the front stronger and more responsible in difficult situations of life and history. And only in very dangerous situations you must go first, because only in this way you can show that you are really a worth leader of the movement. So, being in our therapy offices, we should be at the back of the whole process, which goes on between us and our patients. Thank you for your attention, and I hope I will be able to answer to some of your questions, both in the small groups you can discuss, but also on the round table. We will discuss that. Thank you very much.
My dear colleague, thank you so much for your wisdom and your words and your insight and your presentation to us. Attentiveness, responsibility, competence, responsiveness, solidarity. These are the characteristics that we embody in our work with our patients. These are the characteristics with which we can also look to our world and see if there are ways in which we can offer something to our world. But as you said, always from the back, as Mandela said, not from the front, always from the back. Thank you, dear colleague. Thank you.